Welcome to the South Shore.
It's nice to be here and officially launch our second Nova Scotian longitudinal integrated clerkship location on the South Shore, the other being in Cape Breton.
We are very excited to be part of this endeavor. The physicians in this area are very eager to participate as preceptors. It's going to be a very rewarding experience. Lots of rich practice opportunities. We all remember what it was like to be a student. We all were students and needed to be taught, and still need to be taught. Actually, you teach us with every question that you ask. Why do you do that? What do you think about it? We couldn't have done this without our very generous and engaged communities who are right alongside to help us with these ambitious projects. It would not be possible without the support of the foundations, the auxiliaries, our special donors, and we cannot thank them enough. The Queen's Hospital Foundation and the South Shore Regional Foundation and Auxiliary have been exemplary partners for us, and thank you. I hope you can embrace the experience that is rural medicine.
Dr. Pugh mentioned the efforts and contributions of a number of contributing bodies, particularly Jim and Carolyn Evans, and thank you for coming today. Benefactors of the Health Services Foundation. It's been 2 years to get this project underway, and it requires the commitment of community and physicians and the volition and the interest in teaching. You've heard me say this before, Dr. Dalhousie to teach. It is part of what physicians do. It's intrinsic to our profession, and so to be engaged in that enterprise with you is an absolute treat. So that's why we have over 52 physicians now who have said, yeah, I'm very happy to partake and engage in that enterprise. Let's start with Herman, who will be here at Scotia Regional Hospital. Herman, come on up here. Herman is one of the 5 students that will be here at Bridgewater.
What brought me to South Shore is it's a genuinely nice area. Lots of nice people, lots of nature stuff to do. And I'm interested in rural practice as well. And the fact that you can get a lot of hands-on experience here without having to wait in line behind a bunch of other residents and hire students. Overall, I think it'd really be good for my learning and competence.
Carol is in Lunenburg under the watchful eye of Dr. Millen and her gang.
So the LIC is a lot different from the traditional block clerkship, and I really liked the idea of being able to spend extended periods of time with the same patient, seeing them in different settings, and getting to know them as well as my preceptors and learning from the same people over a long period of time.
Emily, also here at South Shore Regional Hospital with Doctors D'Entremont and Johnson.
I'm originally from Bridgewater, and that's a lot of the reason that I chose to come to the South Shore for LIC. And I was also interested in getting some more hands-on time, given that there'd be fewer students here and we can be more involved with the community.
Marissa is in Liverpool, Queen's General Hospital under the watchful eye of Dr. Blackadar back there, and Nora Mogan, and a team of, I think there's 7 primary preceptors there.
Well, the LIC is a really great learning opportunity for any medical student. It gives you a chance to really get to know your patients and get to know the community and follow them throughout the whole year, which is something that I really wanted to do in my practice, and I'm really excited to get to do it now. And I haven't really spent a whole lot of time in the South Shore before, so I was really keen to get to know a new part of Nova Scotia and to learn what medicine's like in this part of our province.
And Ben, who too will be in Queen's General Hospital.
Well, I like the idea of getting to go to one place and kind of get to know kind of the people in the area and the doctors I was going to be working with, and then sort of building relationships with them over the year instead of being shifted through a bunch of different places and barely getting to know anybody. And I love the South Shore, so I thought it'd be nice to be able to spend a year here.
And so I'd like to take a moment now to invite Micmac Elder Joe Michael for his gracious opportunity to come and give a blessing to our program. So Joseph, without further ado, this is ceremonial tobacco. I invite you to give a blessing to the program. Obviously, the very ground upon which we stand is a blessed ground, and we ask that you bless the teachers, the community, our benefactors, and the students engaged in this momentous occasion.
I will do everything from you.
So here are the brave souls who have entrusted their 3rd year to us. and it's an absolute treat to have them, and we know we're excited about it. We finally get here, so it's a great thing to find out.